You know, what I've always been a little bit shocked about is the fact that it never really got much coverage, but the president's health care reform took $500 billion out of Medicare.
Mm-hmm.
Well, Medicare has already got financial difficulties, so why would you take $500 billion out to put into the expansion of health care coverage for non-Medicare type patients? Now, what they did is they took $98 billion of the dollars of the 500 and put it into closing the donut hole in the prescription drug coverage for seniors, and they implemented a preventive health program. But that's $98 billion of the 500. The rest of the 500 is lost to Medicare, and it doesn't make sense to do that. Then, if sequestration occurs, up to 2% of the money for sequestration also comes out of Medicare. So it's compounding the problem. And so what I'm suggesting is, first of all, let's have an honest discussion of the president's health care reform, which didn't reform health care, just added people to a failing system. And let's have an honest discussion of what's occurring within the president's health care reform that a lot of people are not talking about. 2 new entitlements that do not exist today. If we're already having problems with Medicare, and we're already having problems with Social Security, why would you create 2 new entitlements? What are they? The expansion of Medicaid and the insurance premium subsidy. And you know what that adds up to over the course of the next 10 years? $1.4 trillion that don't exist today. There's not one soul on the expansion of Medicaid yet and on the insurance premium subsidy. So there are 2 new entitlements that have not even started yet. They're inside of the president's health care reform, and they add up to $1.4 trillion. And then we're going to turn around and cut $1.2 trillion in sequestration, harming defense and harming all the other programs that are out there, like agriculture and commerce and you name it. You go right down the list. BLM, Forest Service, Interior, they're all going to have to make reductions. Why would you do that and then turn around and create 2 new entitlements? Talk about a huge reprioritization of spending in this country. They respect my position as chairman of the committee. They wanted to make a philosophical statement that we fundamentally need to change it. And I have to be more of a realist because I'm the guy that actually has to write the thing or rewrite or reprioritize or make the bill work so it can make its way all the way through. So I don't have the luxury of making philosophical statements because we know the Senate's never going to pass the Ryan budget.
In June.
Because the Senate never does anything anyhow. They haven't passed a budget in over 1,000 days. You can't count it as income, and you can't then count it as savings, which is what they're doing. I had the chief actuary, Rick Foster, in my office last week, and I asked him the question, are they double counting? Yes. Will Medicare fail because this money has been taken out if Congress doesn't backfill the money? The answer is yes. I can put those words in his mouth because he said it publicly, and he said it in my office, and that is you can't double count. You can't use the $500 reduction as both a savings and income. It's not honest. You know, the press missed it. They should have pinned Senator Baucus down when he stood on the Senate floor during the presentation of his bill, which he didn't read. He had staff do that, right? He admitted that. And when he said, well, this may cost the government $1 trillion, or it may cost the government 2.5. We don't really know. What? You don't know? And you're going to fundamentally change 1/6 of our economy in the country, and you don't know if it's going to be $1 trillion or 2.5. They continually tried to keep it under $1 trillion, and that's why they separated the doc fix, which wasn't honest either, because the doc fix still needs to be fixed. Doctors cannot afford, in many cases, to see senior patients now because they're not being fully reimbursed, and so they separated that out to try and keep it under $1 trillion. Well, CBO just came out last week with a new estimate. What was it, 1.7 trillion? And we haven't even started most of the program yet. There's still things to be created in 2014. So I'm trying to be as honest with the American public and Montanans as I possibly can. We're not doing this smoke and mirrors stuff. We're pointing out that they took $500 billion out of Medicare, of which they kind of gave some goodies up front in the closing the donut hole and the preventive health. The interesting thing is, somehow, this is the only logic that occurs in Washington, D.C., that when you pass a bill that increases taxes or fees or penalties, and you're getting more money in, before it occurs, if you repeal it, it shows up as an expense because it's lost revenue to the government. So see what the Democrats are doing? They're saying by repealing the law, it's going to cost money. Well, yeah, it's going to cost anticipated revenue that was going to come in as a result of higher taxes, fees, or penalties. Now, most Montanans would scratch their head and say, "Are you kidding me? You're saying that's a cost, that's an expenditure, but you haven't even got the money yet?" Well, yeah, because they already passed the tax increase or the fee increase. So by repealing it, it actually shows up on the ledger as a cost to the government. See the game they're playing? It's a shell game. They've got you convinced. I don't know if they've got you convinced, but you asked the question, and you asked the right question.
That one...
They're saying it costs money to repeal. Yeah, right. Let me give you an example of when the Republicans were in control. They had the House, the Senate, and the presidency. We implemented prescription drug coverage for seniors, Medicare Part D. And we did it in an open market system where we have a number of different packages coming together. At one time we had as many as 41 different packages that were presented to seniors, and you get online and you pick the prescription drug package of your choice. The irony of it is, using their argument, the cost of that has come in at less than expected or anticipated because we did it under the free market system, where there's competition. We didn't go for the government solution, which is what the Democrats wanted. So it came in at less than anticipated cost to the taxpayer, to America. Obamacare hasn't even been fully implemented yet. We did their government solution, and already is coming in over cost. So when the Democrats or the administration tell you, "Trust us, this will work, we'll find the waste, the fraud, and the abuse." Oh, really? Really? Are you kidding me? One of the things I do is I try and learn something new every time I come around, but I also talk about incentives, tax policy, and I've always thought, I don't want to social engineer. Don't get me wrong, okay, please. But you look at Medicare, and isn't it an interesting way people, they smoke and drink and don't exercise and kind of live their life the way they want to and have a lot of fun and such, and then they turn 65 and we put them back together. We reward, sometimes less than healthy lifestyles. And I always thought that Medicare ought to be kind of topsy-turvy, that as you're living your life, if you don't smoke, you ought to be able to take $1,500 off of your taxes. Use the tax code to create incentives to help us lessen our costs in Medicare. You drink in moderation, you get a tax reduction. The interesting thing is corporations can deduct health club dues for employees. You as an individual cannot, and you guys as a small business cannot. Corporate can, you guys can't. So one of the things we talked about along the way of consideration of the healthcare reform was, why don't we create an opportunity, especially with things like a healthy lifestyle, for nutrition and for exercise, for people to be able to deduct something from their taxes. Give them, rather than a punishment to the taxpayer when people turn 65 and we have to pay for all of that, create an incentive for people to actually be able to cut a little something from their taxes along the way.
I remember you saying that.
Yeah. Well, and then my opponent, in the last election said, "Oh, Rehberg's solution to the healthcare crisis is join a gym." Well, that's an oversimplification because there are a lot of different packages. Association health care planning, pools, and allowing everybody to join the federal employee health benefit plan. And we had a lot of ideas. That's just one of the ones I threw out. I think that's the one that one of the TV stations chose to put on TV, opening up the criticism that Rehberg's solution to the healthcare crisis is join a gym. So I haven't done that yet, and this is my opportunity. I'm going to go out and see and talk and listen to them. And they're a small business, too, and they're also affected by taxes and such.
Mom, can I get you just...